Has your doctor told you to lose weight to treat your medical problem? Has your spouse told you to lose weight because you're miserable all the time? Have you told yourself to lose weight because you know you're just not feeling normal and you know your weight has something to do with it? Well, how come you're not able to do something about that? Is it because you think you have to look like this or this in your weight loss efforts? I'm Dr. Stanford Owen. I'm inventor of PrescriptFit medical nutrition strategies. And I'm here to tell you that weight loss is irrelevant. I'm board certified in internal medicine. I've treated sick patients my entire life. That's what I do. I treat sick patients. My job is to make patients well. As an internist and a nutrition specialist, I can tell you right now that there's no more powerful treatment that I use, including shots and pills and everything in my arsenal, as nutrition strategies. Patients get well fast and they get well quickly. You don't have to look like this and you don't have to look like this to treat type 2 diabetes, to cure hypertension, to resolve your hyperlipidemia, your high cholesterol, your triglycerides that cause heart disease, your sleep apnea, your fatty liver, your acid reflux, even your irritable bowel. Weight loss is irrelevant if you want to improve your fatigue, cure your breathlessness, diminish your heartburn, improve your back and joint pain, and even resolve your headache, depression, and insomnia that's affected your brain. Now, this is the typical patient that I treat. If this is you, weight loss is irrelevant. What's relevant to you is that you want to feel better and you want your disease to resolve. And I see patients like you every day. I know what you want. You want food that tastes good. You don't want to be hungry. You don't want to have cravings, and you want to be full. And more importantly, you don't want to be a social outsider. You want to be able to matriculate with your family and your friends, your work colleagues, and lead a normal life. I developed PrescriptFit nutrition strategies as a therapeutic approach to treating medical conditions and their associated symptoms with the use of a specifically tailored diet devised and monitored by a healthcare provider. This is what the FDA recommended back in 2002. Every medical textbook, every professional medical society, including the American Diabetic Association and the American Heart Association, and every government organization, including the National Institute of Health, the Centers for Disease Control, the National Heart, Lung, and Blood Institute, all will tell you that 5% weight loss will cause 80% improvement in your medical problems. Yes, 5% weight loss will include 80% benefit in your medical problems. So here you are, 300 pounds, and 5% or 15 pounds brings you to 285, and 80% of your medical problems are gone. That is true. I see this every day. It's not the weight loss, it's the diet. And our diet strategies help you understand how to do this. So why doesn't your physician offer nutrition counseling in his office or her office? Well, first of all, they have no training. It's not taught in medical school. It's not taught in specialty programs. Therefore, they have no experience. And moreover, they're conditioned by the preconceptions and prejudice that our entire culture has about obesity. PrescriptFit is an extremely potent treatment. I use pills, I use shots, I use everything in my arsenal. I'm not an alternative medicine doctor. I'm a very mainstream doctor. And what I see is potent results and fast results. Now I'm going to bring PrescriptFit directly to you through the miracle of digital media and my 35 years of experience treating patients day in and day out with nutrition strategies and my entire team in association with your healthcare provider. PrescriptFit is proven to be safe and effective and not only give you cost savings in your health issues and your health costs, which is a given, but also even in your food costs. And more importantly, it's easy. You'll see measurable results in days or weeks, not months or years. PrescriptFit has all food groups included. We have no portion control. We add food in a unique strategy so you can measure how that food group affects you. The entire family can participate. More importantly, your cravings, your appetite, your hunger, your satiety or fullness is dramatically improved. And we can even teach your healthcare provider how to use hunger controlling medication if necessary in your case. So why PrescriptFit? Well, first, it's easy, intuitive strategies. You can't not get it. Follow the program, you'll understand the simple strategies involved. It tastes great, there's no deprivation, and you have fast results. It's really 1, 2, 3. Most diet strategies out there are very complicated. You have to use points, you have to use different food groups. It's just too complicated. If it goes past 3, it won't work. And I worked my entire career to get it down this simple. So if you're interested in a 4-week trial to see if you can change your life, change your medical problems, improve how you feel, join us on a 60-minute video where I take you through the whole history of PrescriptFit up to the present, going through the science of how it works. Also read my book, PrescriptFit Medical Nutrition Therapy, and order a startup kit. That'll last you 4 weeks. You can measure whether it's going to help you or not. If you go to drdietmedia.com, you'll see how a simple, happy fat cell in youth enlarges and enrages as it's fed our Western diet until it's angry, producing lots of hormones called cytokines that are causing the diseases that I treat every day. The connection between all these chronic diseases is now evident through understanding these cytokines. It's immensely complicated, but the strategies that we use are not that complicated. They're 1, 2, 3 simple. You don't have to look like this, and you don't have to look like this, although you can if you want to spend large amounts of time and money and energy. But if this is you, and you feel tired and miserable, and your health costs are out of control, your medication costs are out of control, and the side effects are overwhelming, give us a 4-week trial. It's at drdietmedia.com. Weight loss is irrelevant. drdietmedia.com. drdietmedia.com.